Sing out. Eddie, count. Hold this body. Your side. There's no other guy here.
One, Farah.
They can't do that. They can't do the screen. Talk to the screen guy.
Mm-hmm. The global AI market is projected to reach $1,770 billion by
Let's go through this key knowledge point now. Can anyone summarize this lesson?
Early money for Singapore. Oga make you no think about it. Say, relax, it go better. Hey, oh man, why you go the reason? You can talk to you go reach the star. You say, girl, just to do your part. Leave that worry for Kota. Energy in paradise. I'm on the moppa. I know we got better. I'm on come up.
It's just consulted online.
Jakaya. Thank you, Accra. We are home. Distinguished ladies and gentlemen, we are here on the high-level interactive policy dialogue under the theme Advancing Africa's Health Agenda through Domestic Financing, Accountability, and Strategic Innovations. Your Excellencies, Honorable Ministers, distinguished delegates, development partners, colleagues, ladies and gentlemen, good evening and Akwaba. It is my great honor and privilege to welcome you to this high-level interactive policy dialogue, convened on the margins of the African Union Extraordinary Summit here in Accra, Ghana. We gather at a defining moment for our continent. 25 years ago, after the historic Abuja Declaration, Africa continues to pursue the vision of a healthier and more prosperous continent in line with the vision of Agenda 2063, the Africa we want. Yet today, we stand amidst a rapidly evolving global environment characterized by changing and flows, increasing debt pressures, climate-related challenges, humanitarian crisis, and the persistent burden of diseases that continue to affect millions of our people. Distinguished ladies and gentlemen, against this backdrop, today's dialogue seeks to address a fundamental question. And what is this fundamental question? It is, how can Africa sustainably finance its health priorities, strengthen accountability for investments, and harness strategic innovation to deliver better health outcomes for all Africans? Convened jointly by the African Renaissance Trust and His Excellency Jakaya Mrisho Kikwete Foundation, this dialogue brings together distinguished leaders from governments, continental institutions, development partners, civil society, academia, and the private sector to explore practical solutions that can advance Africa's health agenda. The theme of today's discussion, Advancing Africa's Health Agenda through Domestic Financing, Accountability, and Strategic Innovations, speaks directly to the urgency of moving from commitment to implementation, walking the talk and going beyond rhetoric, so that at the end of the day, we will not become cemeteries of seminars, cemeteries of conferences, where there is no action after what we've decided. And somebody today taught me a new word, an acronym, meaning NATO. No action to, excuse me, sir, are you in the hall? No action, talk only. That will not be our portion. We are going to speak, and we'll take action, and we'll move beyond to implementation. Africa's health future requires stronger domestic resource mobilization, improved efficiency in public spending, enhanced accountability mechanisms, and innovative partnerships that place African ownership and sustainability at the center of our own development journey. As we normally say in the African Union, Africa solutions to African challenges. That is the Africa we want. So this conversation is not only about financing health systems, it is about investing in Africa's people, protecting mothers and children, strengthening reliance and resilience against health emergencies, advancing human capital development, and building a continent that is healthier, more self-reliant, and better prepared for future challenges. Distinguished ladies and gentlemen, I will want to continue by saying that we are honored today by the presence of leaders whose dedication to Africa's transformation continues to inspire action. In this opening session, we have 3 speakers. The guest of honor, Her Excellency, Professor Jane Opoku Ajiman, represented by the Honorable Deputy Minister of Health, Honorable Professor Dr. Grace Anyesu Dankwa. Please, a round of applause. I've been talking, you've not been clapping now. Hey. And then our keynote speaker, a Pan-Africanist in the person of His Excellency, Dr. Jakaya Mrisho Kikwete. And then we are going to have our anchor remarks by the very person that the subject we are discussing falls under at the African Union, Her Excellency, my sister, Ambassador Ama Adoma Tum Amoa. A round of applause. Now I will have the honor to bring them forward on the podium. I'm looking for those who are supposed to give me one document on Her Excellency, the representative. So I will start by calling forward our distinguished panelists, one of Africa's foremost champions of continental cooperation and human development, Her Excellency, Ambassador Amatum Amwa. Her Excellency, Ambassador Ama Adoma Tum Amoa serves as the African Union Commissioner for Health, Humanitarian Affairs, and Social Development. In this capacity, she provides strategic leadership for the African Union's work. I deliberately took my mouth out there because I have a very high voice. In this capacity, she provides strategic leadership for the African Union's work in strengthening health systems, advancing universal health coverage, improving humanitarian response, and promoting social development across member states. A seasoned diplomat with decades of experience in regional integration and multilateral engagement, No, but this is the welcome panelists. Okay. Oh, sorry. I hope you didn't hear what I said. Thank you. Thank you very much. So this is the opening ceremony panelists. She said I should emphasize that. Thank you. So, in this capacity, she provides strategic leadership for the African Union's work in strengthening health systems, advancing universal health coverage, improving humanitarian response, and promoting social development across member states. A seasoned diplomat with decades of experience in regional integration and multilateral engagement, Ambassador Tum Amoa has played a pivotal role in shaping continental policies and fostering collaboration among governments, regional institutions, and development partners. At a time when Africa is seeking sustainable pathways to finance and strengthen its health systems, her leadership and vision are helping to drive a more resilient, equitable, and self-reliant future for the continent. Ladies and gentlemen, please join me in welcoming Her Excellency, Ambassador Ama Tum Amoa, no, you sit down. Yes, then I'll call you back. Yay! Please clap for them. They are entertaining us. Thank you very much. It is my distinct honor and privilege to welcome a distinguished African statesman, Pan-Africanist, whose leadership has left an enduring mark on the continent's development agenda. His Excellency, Dr. Jakaya Mrisho Kikwete, served as the fourth President of the United Republic of Tanzania from 2005 to 2015. Throughout his tenure, he championed economic growth, regional integration, peace, and social development, while placing significant emphasis on improving access to health and education for all Tanzanians. Beyond his presidency, His Excellency has continued to serve Africa with remarkable distinction as founder and chairman of His Excellency Jakaya Mrisho Kikwete Foundation. He has become a leading advocate for maternal, newborn, and in advancing African-led solutions and mobilizing political commitment to improve health outcomes from the continent. Distinguished ladies and gentlemen, please join me in warmly welcoming His Excellency Dr. Jakaya Mrisho Kikwete. Where is he? The one representing the Vice President, Dr. Grace. Yes, I want to. Thank you very much. And I'm happy that they say we give honor to whom honor is due. And you have jointly stood up in a standing ovation to recognize one of our own. That is wisdom. Thank you very much. Distinguished ladies and gentlemen, the next person I'm introducing here, you can see the way I'm taking my time to say here, is our Vice President, Her Excellency, Professor Jane Nana Opoku Ajiman. She is not here because there was an unforeseen issue, but she has sent a very distinguished representative in the person of, please, the phone, in the person of Honorable Deputy Minister of Health, Honorable Professor Dr. Grace Anyensu Donkwa. No. Let me read your CV. No, wait. Thank you. Honorable Grace Anyensu Donkwa is a surgeon. I never knew surgeons can be this sexy. He's a surgeon, academic, and politician. Currently, the Deputy Minister of Health and Member of Parliament for Esikado Kentang constituency. She is a U.S. double board certified general and reconstructive surgeon. Women, hey! When I'm reading this, I'm having goose pimples. She has taught global surgery for over 15 years at the University of Utah and lectures at the University of Cape Coast. She is fellow of the American College of Surgeons and Ghana Colleges of Physicians and Surgeons. As member of the Parliamentary Committee of Gender, Children and Social Protection, she is passionate advocate for women and children's health. Honorable Dr. Ayesi Dankwa, thank you for coming to the podium. Yeah. You have to be learning things like this. If not, you will go without learning anything. Thank you very much. So, now we start with our program. I will therefore call Her Excellency Ambassador Adoma Tum Amoa to take the floor. Thank you. No, I will be using them. I'm sorry, Mama. You see, I'm spoiled. Sorry.
Thank you very much, Prof. She's also a professor. She didn't say it. Your Excellency, Dr. Jakaya Kikwete, former President of the United Republic of Tanzania and a health advocate. Honorable Professor Grace Sudankwa, Deputy Minister of Health and MP for Esikado Ketan. Honorable Nana Oye Bampo Ado, Deputy Chief of Staff of the Presidency, heads of agencies and development partners, distinguished guests, ladies and gentlemen, and of course, our dear brothers and sisters from the press. Good evening to you all. Thank you. I'm honored to join you today for this high-level interactive policy dialogue on advancing Africa's health agenda through domestic financing, accountability, and strategic innovation. Allow me to express my sincere appreciation to the African Renaissance Trust and the Jakaya Kikwete Foundation for convening this timely and consequential dialogue. And it's timely because obviously it's going to feed into the discussions that we're going to have in the next 2 days. Africa stands at a defining moment in its pursuit of universal health coverage, health security, and sustainable development. While our continent has made important progress in improving health outcomes, persistent financing gaps, emerging public health threats, demographic pressures, and growing demands on health systems require renewed political commitment and decisive action. The central message for all of us here is clear. Africa's health future must be financed sustainably and predictably, governed accountably, and transformed through purposeful innovation. We must begin by reaffirming a fundamental principle. Expenditure on health is not merely a social cost. It is a strategic investment in human capital, economic growth, productivity, national security, as well as resilience. A healthy population is the foundation of a productive economy. A resilient health system is the first line of defense against epidemics and other emergencies. And equitable access to health care is essential to dignity, to stability, and to social cohesion. External partnerships remain important and deeply valued. However, no health system can be truly sustainable if it depends predominantly on external assistance. Africa's health security cannot be outsourced. And I think we are all witnesses to that. The shock that some of our nations faced when something happened. Member states must therefore progressively increase domestic investment in health by giving health greater priority within national budgets, strengthening domestic resource mobilization, improving the efficiency and effectiveness of public expenditure, and adopting innovative financing mechanisms that provide equitable, predictable, and sustainable funding for essential services. This is not only about mobilizing more resources, it's equally about making every available resource work harder and deliver better results. Excellency, Honorable Minister, distinguished guests, accountability must remain at the center of health sector governance. Financing without accountability risks inefficiency. Accountability without reliable data becomes difficult to enforce, and data without decisive action cannot improve lives. Governments must strengthen transparent systems for planning, budgeting, procurement, implementation, monitoring, and evaluation. We must be able to demonstrate not only how much is allocated to health, but also where the resources go, whom they reach, and what results they achieve. Evidence-based decision-making, timely reporting, and the meaningful participation of communities, civil society, young people, the private sector, and other stakeholders are essential. These measures build public trust, improve institutional performance, and ensure that resources translate into measurable health outcomes. Ultimately, accountability must be measured not only through reports and scorecards, but through lives saved, diseases prevented, and communities protected. In February 2019, the African Union convened the African Leadership Meeting on Investing in Health in Addis Ababa. That landmark meeting brought together heads of state and government, as well as regional and global leaders, and culminated in the adoption of the Addis Ababa Commitment towards shared responsibility and global solidarity for increased health financing, widely known as the African Leadership Meeting Declaration. The declaration remains a central framework for advancing health financing across the continent. It calls upon member states to increase domestic investment in health and measure progress through the African Scorecard on Domestic Financing for Health, establish stronger tracking and accountability mechanisms, strengthen collaboration between Ministries of Finance and Health, improve public financial management and domestic revenue mobilization, and promote the efficient allocation and utilization of resources. It further calls for regional health financing hubs across Africa's 5 regions, stronger engagement with the private sector, better alignment of development partner investments with national and continental priorities, and the digitization of the Africa Scorecard to improve access to timely, reliable, and actionable data. These commitments are not merely technical aspirations. They are also political obligations. Their credibility will be determined by the quality, pace, and consistency of their implementation. The African Union Roadmap to 2030 and beyond places resilient, equitable, and sustainable health systems at the heart of Africa's development agenda. A strong health financing architecture is central to this vision. It ensures that adequate and predictable resources are mobilized, pooled, and managed efficiently to deliver quality health services to all. Through stronger domestic resource mobilization, strategic purchasing, effective risk pooling, and robust financial protection mechanisms, Member states can reduce catastrophic out-of-pocket expenditure and expand equitable access to essential health services, particularly for women, children, young people, persons with disability, displaced populations, and other vulnerable groups. No African should be forced to choose between seeking health care and feeding their family. No child's future should be determined by whether their parents can afford treatment. And of course, no mother should die giving life. Universal health care coverage must mean access for all, not access only for those who can pay. Beyond 2030, our health financing agenda must continue to strengthen health system resilience, promote efficiency and accountability, and reinforce preparedness for future public health emergencies. By aligning health financing strategies with national development priorities and fostering stronger partnerships across sectors, we can build sustainable systems that leave no one behind. Excellency, Honorable Minister, distinguished delegates, strategic innovation must also be at the center of our efforts. Africa must harness digital technologies, integrated data systems, artificial intelligence, innovative service delivery models, and new financing instruments to extend access, improve efficiency, and strengthen accountability. But innovation must be purposeful, ethical, and inclusive. It must respond to African realities, protect individual rights, strengthen national institutions, and reduce rather than deepen inequalities. Technology should support health workers, empower communities, and strengthen public health systems. It should never become a substitute for human-centered care or sustained public investment. We must also invest in African research, local manufacturing, regulatory capacity, and homegrown solutions. Africa cannot remain merely a consumer of health technologies developed elsewhere. We must become a continent that designs, produces, and scales the solutions required to protect the health of its people. This dialogue is particularly timely, as the extraordinary session of the Assembly of the African Union on Health is held the next 2 days. The issues before us today, domestic financing, accountability, and strategic innovation, are central to the summit's principal agenda and will inform the deliberations of African heads of state and government. The summit provides a historic opportunity to move from the declarations to delivery, from fragmented interventions to coordinated action, and from dependency to greater self-reliance. The African Union Commission therefore calls for bold and sustained investment in health, strengthen accountability for both resources and results, improve the efficiency and equity of health expenditure, promote responsible innovation across our health systems, and build partnerships that place the health and well-being of all Africans at the center of national and continental development. Distinguished delegates, the time for action is now. I believe, and I say it all the time, we've done enough of talking. We have to put our words into action. The people of Africa cannot wait for us forever. Our communities must be reflected in our budgets. Our priorities must be demonstrated through implementation, and our progress must be measured by the improvements experienced in the daily lives of our people. By investing in sustainable financing, accountable governance, and transformative innovation, Africa can build healthier populations, stronger economies, and more resilient societies. Together, we can build health systems that are equitable, responsive, and capable of protecting both present and future generations. Together, we can advance universal health coverage, strengthen Africa's health sovereignty, and deliver the healthier, more resilient, and more prosperous continent our people deserve. So the responsibility lies on all of us. I thank you very much.
A round of applause, please. There's a doctor in the room. I need reconstructive surgery to lose some of these weights. Thank you very much, my sister. I was taking notes as you were speaking, and I think Your Excellency, Ambassador Tum Amoa, you have set the continental context for our deliberation. Thank you very much for those insightful reflections that you have spoken. One thing caught me: no African should be left behind, and no mother should die while giving life because of a lack of access to quality health care. Universal health coverage is not just an aspiration, it is an imperative. We must align our health priorities with sustainable financing to build resilient health systems across Africa. And you said Africa must harness the power of digital technology to expand access to healthcare, accelerate innovation, and strengthen service delivery. Technology should empower people and improve health outcomes for all. Thank you very much. A round of applause for her again. Thank you. Now, it is my distinct honor to invite the patron of this dialogue, His Excellency, a Pan-Africanist and a military man that speaks like a surgeon. His voice is never high. His Excellency, Dr. Jakaya Mrisho, Kikwete, to deliver the keynote intervention. Your Excellency, we look to you to speak to how our governments can deploy life-saving maternal innovations, strengthen the core elements of pharmaceutical regulation, and structurally integrate financing and accountability alongside the continent's frontline defenses against HIV, TB, and malaria. Excellency, the floor is yours. A round of applause, please. A presidential round of applause.
Well, thank you very much, Madam Moderator. You've given a lot of life to our event today, and please continue to do the good work. Honorable Professor Dr. Grace Ayen Sudankwa, Deputy Minister of Health of the Republic of Ghana, representing Her Excellency, the Vice President, Your Excellency Ambassador Ama Tum Amoa, the African Union Commissioner for Health, Humanitarian Affairs and Social Development, Professor Sarah Anyang Angbo, our moderator, distinguished participants, ladies and gentlemen. Allow me to begin by expressing our sincere gratitude to the government and the people of the Republic of Ghana for the warmth of reception and gracious hospitality. We also thank you for hosting the all-important African Union Extraordinary Summit on Health. In a special way, I extend my sincere appreciation to the African Union Commission, the African Renaissance Trust, and my team from our foundation, together with all partners, for convening this dialogue on the eve of the summit. Ladies and gentlemen, we meet at a defining moment. In the coming 2 days, our leaders, the ministers, and the African heads of state and government will gather here in Accra pursuant to Assembly Decision 852 to accelerate action on ending AIDS, preventable maternal health, communicable and non-communicable diseases, and on strengthening health systems by 2030. And we meet in the 25th year of the 2001 Abuja Declaration on Health. Indeed, it is a fitting moment to ask ourselves honestly whether our commitments have been matched by delivery. Excellencies, ladies and gentlemen, 5 months ago, in Mbabane, the Kingdom of Swaziland, I had the honor of speaking to senior health officials on the eve of the 76th conference of the Ministers of Health of the Eastern, Central, and Southern Africa Health Community. I said then that the historical model of heavy reliance on external aid is no longer sustainable. Indeed, aid has become unreliable these days, and the statistics have since confirmed it. Official development assistance fell by 23% in 2025, and external aid for health dropped by as much as 40%. This is the largest annual decline ever recorded. The ministers and participants in Eswatini responded with a clear resolution of aspiration to make national budgets the primary source of funding healthcare and in their respective countries. Also, the major means of getting the needs to invest in primary healthcare development and to plan orderly transition of donor-supported programs onto domestic financing. They also underscored the significance of the active participation of the African private sector in the health sector. And I'm glad we are representing the African private sector is very ably represented by its president. I think, can you stand up so that they know you? Yes. The message from Eswatini to Accra is one and the same. Africa must increasingly finance, manufacture, and secure its own health future. Excellencies, distinguished participants, ladies and gentlemen, if there is one issue that should unite us regardless of geography, politics, or ideology, is the life of the African mother. Globally, every year, 260,000 women die from complications related to pregnancy and childbirth. Sadly, nearly 70% of these women happen to be African women. It is difficult to comprehend how possible in the 21st century this is happening. We all know this is the time when the world possesses knowledge, the medicines, and the technologies to prevent most of this death. I'm inclined to believe that this is not a scientific failure, but rather an implementation failure, and political will is the subject of serious discussion under this. Nonetheless, the encouraging thing is that solutions exist. The Goalkeepers Research and Development Portfolio has set out a costed basket of low-cost frontline innovations, from tools that stop postpartum hemorrhage to portable ultrasound and simple newborn care. All these tools could save those close to 2 million mothers and babies by the year 2030, and more than 6 million by 2040. Ladies and gentlemen, I speak of this with conviction because I have seen what happens when evidence guides investment and investments reaches the front line. In Tanzania, our foundation worked with the Ministry of Health and national research institutions to map out the maternal and newborn health landscape and to convene a national, after doing that mapping, we all agreed to convene a national scientific conference that now meets every 2 years. The National Scientific Conference on maternal, newborn, adolescent health that meets every 2 years. Over that period, maternal mortality in my country has fallen from more than 550 deaths for every 100,000 live births to 104. Tanzania is now on course to possibly meet the SDG target of 70 deaths for every 100,000 live births by 2030. The MDGs gave a target of 191 deaths for every 100,000 live births. This was 2000. I was foreign minister at that time. I attended the summit in New York. In 2005, I became president. At that time, the target for MDGs was to get to 191 deaths for every 100,000 live births by 2015. We struggled. I inherited a time when death was 578 for every 100,000 live births. We worked hard. We came up and down, up and down. There was a time we went to 576, and then we went to 579, and then we came down. We worked hard, but by the time I left office, we had only attained 453. And the target was supposed to be 191. So it is one of the things that motivated me, that let me spend part of my retirement on maternal and child health issues. So that's how we joined hands with the Ministry of Health. We came up with the idea of the National Scientific Conference. We brought under one roof about 1,000 practitioners from national level to regional level to district level who were involved in the maternal and child health and adolescent health area. We had a soul-searching discussion. Why? Why are we in this state of affairs? But most importantly, how do we get out of here? So we called each other names. We identified who is supposed to do what and what needs to be done. And after that, there was concerted effort. And that concerted effort brought down the figures from 550 to 104. At first, when I got that data, I asked myself twice, is this true? But it was confirmed by the ministry, by the WHO, and everybody else that the data is correct. That is why it gives us hope. But the SDGs has given us an even bigger task. Get to 70 for every 100,000 live births. If when we were given the target of 191, we could only do 453. How do we move from 453 to 70? And the SDG summit, I was president. I participated in New York. I was part of the decisions of the targets that were set. So that's why I felt obliged to work with my colleagues, my successors in government, so that we could also help if there's anything that we can contribute to do that. But the point I'm saying is, when mothers return home safely, it is because financing, evidence, and delivery were finally made to meet. The challenge before the summit, therefore, is not invention, but it is deployment. Moving these innovations out of conference presentations and the pilot projects into the hands of nurses, midwives, and community health workers who save lives every day is the critical question. Excellencies, this brings me to financing and accountability. The question before us is not simply how much we spend on health. It is whether our investments reach the people who need them most. Citizens do not measure health financing in percentages of the GDP. That's the pastime of economists. They spend 6%. The citizens' preoccupation or interest, they measure concerned about whether the health worker is present. There is somebody to take care of them, of him or her. You're talking about how much of the national budget or the GDP, percentage of the GDP you are spending. Of course, it is what will translate into that. But to them, they will always say, we went there, we were only written a prescription, but there is no. We went to the counter, we couldn't get the drugs. We went to the hospital for delivery, the dispensary doesn't have a midwife. These are the critical questions that people ask. And if you say, but you know, this is how much we spend on as percentage of the GDP, they say that's your business. Is there a health worker? Are the drugs available on the shelf? But whether the facilities have the diagnostic and curative facilities. You know, I was born in the village. I grew up in the village. The first time I wore shoes was when I went to secondary school. That's the reality of life. I can't pretend. My children are not walking barefoot these days. It was me. But in those days, you go to a dispensary. It's okay, fine. Can I see your tongue? Your eyes? Where does the head weigh? Here? Here? or here in the middle? Malaria. You go to the counter. In those days, we used to get quinine. It's a yellowish kind of a drug. Very bitter. Very bitter. You drink that, off you go. And you get aspirin 2-3 times a day. There was no microscope. There was nothing. It's only the doctor listening to you. The deputy minister is a professor of surgery. I don't think you train your young physicians that way. You train them to use the proper diagnostic tools. I remember when I was president, we've been working with a number of institutions. I remember working with New York, Cornell University. And they used to come, the Department of Neurosurgery. But when they come, these experts, their requirement first, there has got to be a CT scan. There has to be an MRI scan. Fortunately, they work with the National Hospital, where there is a CT scan, there is an MRI scan, there is an ultrasound machine. You can't have that in the district hospitals. You can't have that in the rural hospitals. But, and our people there don't demand all this. In our foundation, we discovered that we have a high maternal mortality and neonat death. But in areas that are very hard to reach. So we came up with the idea of mobile antenatal clinics. We've been working with some foundations. They donated to us. We're doing it in a pilot scheme. You'll be amazed that some women have had 3 births and they had not been to an antenatal clinic. This has been the first time. And we're not talking about small numbers. We are talking of 800 women visiting the clinics. So this is the reality on the ground. So these are the challenges. But you cannot solve solutions to these ones without financing. Countries across our continent are already showing the way. Kenya, for example, has earmarked health levies. Tanzania is scaling up national health insurance, make it universal. Malawi has direct facility financing. Mauritius has strategic purchasing. But this is to mention but a few. So all countries have waken up. They are trying all they can to make sure that there is financing for healthcare development. What we have lacked is a shared continental line of sight between commitment, the budget, and the result. That is why I attach such importance to health financing insights dashboard that will be demonstrated a few moments from now. It gives us, the government, people in the philanthropic community, the private sector, a way to see the return on commitments. It also gives ministers of health and finance a joint view and a common language. In the spirit of the African Leadership Meeting, accountability must now become a central pillar for health financing, because if we avoid waste, we can do more with less. I worked on a commission on education with Gordon Brown. And in our analysis, we came out, we said, there are problems of financing, but there is a lot of waste in expenditure. If there is going to be proper spending, there's going to be accountability. The little that we have can have an impact that is required. That's the point I'm making here. Your Excellencies, ladies and gentlemen, COVID-19 taught us that dependence creates vulnerability. Africa still imports 80 to 100% of its medicines and over 99% of its vaccines. And we saw during COVID, when we asked for the vaccines, because this time COVID attacked the developed countries most than us. So you ask to get the vaccines, they don't give you. They wanted first to satisfy their needs. That was an important lesson. We may not be able as individual countries to be able to build that capacity. But at the continental level, we can work on this, and this is where the Commissioner is important. That should serve a lesson to us. So you get PPPs, donation from one country, but after they met their set. And so it is important. The lessons from COVID should serve. The African Medicines Agency, working with the Pharmaceutical Plan for Africa and the Continental Free Trade Area, offers the pathway to pharmaceutical sovereignty, which I would like to urge every member state to ratify, finance it, and use it. And as we do so, we must finish the unfinished business. About 25.6 million Africans are living with HIV/AIDS. 420,000 of them are still dying of AIDS-related causes each year. Tuberculosis is claiming an African life every minute, and malaria is moving into new areas with changing climate. You know, Tanzania has the lowlands along the coast, Indian Ocean, but we have the highlands, Mount Kilimanjaro, which is 6,000 meters. In the past, there used to be no mosquitoes in the highland areas. These days, mosquitoes are there because it is warmer. These days, the mosquitoes can also live anywhere. So these are some of those effects of climate change. The catalytic framework gives us the roadmap. Instruments like ALMA, the ALMA scorecard, show us that when leaders can see performance, leaders act. There is Joy Pumapi, I think she should appear in the video. When a few of us, I think there were 9 African leaders who sat down and conceived the idea of establishing the African Leaders Malaria Alliance, they chose me to be their chair because I'm the one who was the brain behind that initiative. Then we got the services of Madam Joy Pumapi, very bright young lady. She has served the continent well. She served her country of Botswana well, and she's serving the country, the continent very well. She came up with the idea of a scorecard. On the left-hand side, you have the indicators. And on the right-hand side, you have yellow, you have green, yellow, red. So we came up with the idea, let's organize a luncheon during every summit of the African Union. And during the luncheon, we hand over these scorecards to the heads of state. So when a president sits there and sees red in all the indicators, they get concerned. They call their ministers. Why? Some say, but sir, you know, we've been trying to get money from the Ministry of Finance. They don't give us money. So I'm going to solve the problem. That is how we got traction. There was a lot of response. There was a lot of awareness and interest. The leaders began to invest in malaria. And at one point, we were, in terms of reducing infection rates and death rate, Africa was actually performing better than any of the other regions. So there's this kind of an initiative. But the brain behind the scorecard is that young lady there. She will have time. She may speak and share her experience on how we came up to that idea, and it really worked wonders. Of course, now there are challenges. She may speak about them. Yes. Because the parasites are also fighting to kill us. The mosquitoes are also fighting to survive so that they can live on our blood. But I think scientific work is ongoing, and Joy can share what they've been doing in that area. So, for our part, in our foundation, leading the strengthening of health financing initiative supported by the Gates Foundation. Through this initiative, our foundation is mobilizing a cohort of high-level African champions, as well as convening a leaders roundtable that brings together the African Union, regional economic communities, ministers, donors, and multilaterals to discuss health issues and agree on the way forward. In addition, our foundation is working with the Eastern, Central, and Southern African Health Community and the Southern African Development Community as hubs for peer learning and joint advocacy. These efforts are building towards a joint declaration, one that calls for predictable and respectful donor engagement, renewed investments in the Global Fund and Gavi, and above all, decisive domestic action. The communique of this dialogue will be transmitted to the Executive Council of the African Union and the Summit, and we offer its substance to the Accra Reset Agenda as Ghana prepares to assume the chairmanship of our continent organization, the African Union, next year. We are all excited because we have high regard for leadership of President Mahama. Excellencies, as we go into the summit, allow me to respectfully underscore 5 things. First, that we must treat health as a strategic investment embedded in our national development plans and fiscal frameworks. 2, that we accelerate domestic resource mobilization through insurance reforms, health insurance reforms, innovative taxation, and efficiency gains. 3, that we promote essential services like those for HIV, malaria, immunization, maternal health, child health through the funding transition. 4, that we institutionalize accountability so that every cedi, shilling, or franc delivers a measurable outcome. And 5, last but not least, that we strengthen regional collaboration, for Africa's strength has always been in solidarity. Ladies and gentlemen, Africa does not suffer from a shortage of commitments. We are so good at making commitments. Africa does not suffer from a shortage of strategies. We have 101 strategies. Africa increasingly does not suffer from a shortage of innovations. We are very creative and innovative. What Africa needs is implementation at scale. Let us therefore leave Accra determined to turn commitments into budgets, budgets into programs, programs into measurable results, and results into longer, healthier, and more productive lives for the people we serve. Let history record that it was here in Accra, Ghana, that Africa decisively chose to finance its health substantially, efficiently, and for generations to come. With those many words, ladies and gentlemen, I thank you for your kind attention.
Another round of applause, please. Thank you very much, Your Excellency. Thank you very, very much. Because you've emphasized that we must leave Accra determined to transform commitments into budgets, budgets into programs, programs into results, and results into longer, healthier, and more productive lives for the people we serve. This must become Africa's reality. And one other thing that you said that stuck to this head, Africa does not suffer from a shortage of ideas, strategies, or innovations. What we need is a collective will, sustained financing, strong partnerships, and effective implementation to ensure that these solutions reach the people who need them most. Action, action, action on the ground. And the time has come to move from commitment to action, from plans to impact, and from ambition to measurable results for every African community. Please, can we put our hands together again for the distinguished President? Now, in my country, we say the train is moving. We are getting now to the next speaker in this opening session. Her Excellency, Professor Jane Nana Opoku Ajimang, serves as the Vice President of the Republic of Ghana. She is the first woman in Ghana's history to hold the distinguished office, marking a significant milestone in the nation's democratic journey. She is a renowned academic and former Vice Chancellor of the University of Cape Coast. She has dedicated her career to advancing education, equity, leadership, and national development. She also served with distinction as Ghana's Minister for Education, where she led important reforms to strengthen the country's education. She also served on the Forum for African Women Educationalists, where I also serve presently as a Vice President of the Forum for African Women Educationalists. Please clap for me now. Now waiting. So as Vice President, she continues to champion policies that promote human capital development, social inclusion, gender equality, and improved health and well-being for all Ghanaians. Her leadership reflects a deep commitment to building resilient institutions and ensuring that Africa's development is driven by investment in its people. One of the emphases of Ambassador Ama's speech, and also the emphasis of His Excellency Dr. Kikwete. Please, distinguished ladies and gentlemen, excellencies, join me in giving a warm welcome to Honorable Deputy Minister of Health, Honorable Professor Dr. Grace Ayesu Dokwa, representing Her Excellency Professor Jane Nana Opoku Ajiman.
Thank you, everyone. Your Excellency, Dr. Jakaya Mrisho Kikwete, Honorable Ambassador Amachum Amwa, Honorable Nana Oyebampo Ado, Her Excellency Professor Sarah Anan Agbor, Honorable Ministers of Health and of Finance, Honorable Ministers and other government officials, distinguished representatives of the AU Commission and of our regional economic communities, leadership of our continental and international institutions, philanthropic organizations, representative of academic institutions, and our development partners, colleagues, sisters, and brothers, good evening. As you know, Her Excellency, the Vice President of the Republic of Ghana, was meant to be here with you. However, Her Excellency was called away by other national duties today and asked me to send you her best wishes. It is a pleasure to welcome you all to Accra on behalf of His Excellency John Dramani Mahama, President of the Republic of Ghana. Before I continue, allow me to recognize His Excellency Dr. Jakaya Mrisho Kikwete, whose steadfast leadership has kept maternal, newborn, child, and adolescent health high on Africa's development agenda. Ghana is honored to welcome you. That's why you clap, right? I also thank our continental institutions, developmental partners, and all those who have contributed to this dialogue. Your presence shows a shared commitment to strengthening Africa's health financing. We are meeting on the sidelines of an extraordinary session of the African Union Assembly, convened to end AIDS by 2030, to address preventable maternal death, to confront communicable and non-communicable diseases endemic on our continent, and to strengthen our health systems. Ladies and gentlemen, it has been 25 years since the Abuja Declaration on HIV/AIDS, tuberculosis, and other related infectious diseases. At the time, we committed to dedicating at least 15% of our budget to the health sector. 25 years call for an honest reflection on where we are today. Official development assistance is less certain. Long-standing funding modules are changing. Programs that many health systems have relied on can no longer be taken for granted. That reality means Africa must strengthen its ability to finance its own priorities, build enduring institutions, and invest in health, not as a recurring expense, but as a foundation for economic growth and human development. The Accra Reset reflects that conviction. It is an affirmation that Africa's future will be shaped increasingly by our choices, institutions, and investment. Far more than a social priority, Health is a foundation of national development. When populations are healthy, they are more productive. Their children learn more effectively, and their economies are better able to grow and withstand shocks. For its part, therefore, the government of Ghana is pursuing universal health coverage by expanding access, improving health outcomes, and reducing out-of-pocket costs. While our national health insurance scheme has significantly expanded across and access to healthcare over the years, the government identified critical gaps in the system, particularly in preventive healthcare and financing treatment for chronic non-communicable diseases. To address these challenges, 2 flagship initiatives have been introduced and are being championed by our Ministry of Health. The Ghana Medical Trust Fund, popularly known as Mahama Cares, and the Free Primary Healthcare Initiative. The Ghana Medical Trust Fund was launched last year to provide financial support for the diagnosis, treatment, and long-term management of chronic non-communicable diseases that are either inadequately covered or not covered at all under the National Health Insurance Scheme. Beyond supporting patient care, the fund also contributes to strengthening specialist healthcare by investing in medical infrastructure, equipment, research, and specialist training. The government also launched the Free Primary Healthcare Initiative this year. It is designed to complement the National Health Insurance Scheme by making essential primary health care services accessible. The initiative places strong emphasis on preventive health care, which is more effective and less costly than treating advanced illnesses. Under the program, every Ghanaian is entitled to regular basic health screening, including tests for conditions such as hypertension, diabetes, and certain cancers. The initiative also provides maternal and child care services, immunization, treatment of common illnesses, community outreach, home visits, public health education, aiming at promoting healthy lifestyles. It is being implemented in phases, beginning with 150 underserved districts, with nationwide coverage expected in a few years. Government has made a 50 million seed investment in the National Vaccine Institute to strengthen local vaccine and pharmaceutical manufacturing. This builds on Ghana's regulatory capacity, including the Food and Drug Authority's WHO Maturity 3 level status, and recent progress towards the commercial production of locally manufactured anti-snake serum. None of this is to suggest that our healthcare delivery system does not still require significant improvement. I am therefore pleased to learn that the African Renaissance Trust has developed a health financing insight dashboard intended to make health financing commitments and outcomes easier to track across the continent. I thank the Trust for presenting this work and look forward to the discussion it will generate among governments, continental institutions, and development partners. Distinguished guests, the work before us extends beyond health financing alone. It calls for stronger pharmaceutical manufacturing, more integrated markets, greater investment in skills, more efficient system for trade and payment, and institutions capable of supporting these ambitions over the long term. Many of these initiatives being advanced by the African Union, its member states, and continental partners. Together, they point towards a more resilient and more self-reliant Africa. Ghana is fully committed to contributing to that. When this dialogue concludes, I hope the following convictions will guide our work in the months ahead. First, we must continue to strengthen domestic health financing. Second, we must continue to invest in the institutions that will sustain Africa's health ambitions, from regulation and local manufacturing to research, innovation, and our workforce. Third, we must continue to hold ourselves accountable for the commitments we make. Our declarations must be translated into measurable progress in the lives of our people. Ghana remains committed to working with the African Union, our continental institutions, our partners, to advance these shared objectives. Together, we will build health systems that are stronger, more resilient, and better prepared for the generations to come. I thank all those who have contributed to this dialogue. I'm confident that the discussions we begin here will continue to inform Africa's efforts to strengthen health financing and improve health outcomes. I look forward to the communique that will carry these commitments into the Assembly tomorrow. May God bless the African Union and bless us all. I thank you for your kind attention.
Another round of applause, please. Thank you very much. We must continue to strengthen collective health action and deepen collaboration across the continent. We must also continue to hold ourselves accountable and ensure that our commitments translate into meaningful results for the people we serve. And moreover, Ghana remains committed to working with the African Union and our partners to advance health security, strengthen health systems, and accelerate progress towards achieving better health outcomes for all Africans. And she emphasized that tasks before us require unity, partnership, and sustained commitment. Together, we can build a healthier and more resilient Africa. Another round of applause. Thank you very much. And the issues you raised while speaking translates us to the next session that we are going to take now immediately. Because all that you said, particularly in appreciating the African Health Dashboard, is now very important for us to give a little 5 minutes demonstration of that African dashboard. So we now move into our fireside policy dialogue. And yes, sir, you were just thinking about, we were on the same line, telepathy. Please, music, why they go down? Thank you, sir. Thank you very much. I need reconstruction. Abogorigi, a round of applause for them too. Thank you very much. So, as we move to our fireside policy dialogue, I am pleased to hand over to Ms. Caroline Kwamboka, Director of the African Renaissance Trust, who will moderate our panel of distinguished leaders. Caroline, the floor is yours. Please clap for my boss now.
Thank you very much, Professor Sarah, for taking us through a wonderful opening session. And we are now going to move swiftly into the panel. And before we start the panel, we will make a demo for about just 5 minutes. As we are running out of time, I think the evening is very beautiful and warm. But we will do our best to save the time so that we can catch up with a little refreshment outside. So for this session, I will, take the honor of calling our panelists to the table, to the podium, so that we can, have them seated, and then we will proceed, do a 5-minute demo, and then get on with engaging the panel. So at this point, I take the pleasure of inviting Honorable Nana Oye Bampoe Addo. Honorable Bampoe Addo is a Ghanaian politician. She's a human rights advocate who currently serves as the Deputy Chief of Staff at the Office of the President of the Republic of Ghana. Warm welcome to you, Madam Nana. She served Thank you. Thank you. Honorable Nana Oye served as Minister for Gender, Children, and Social Protection from 2013 to 2017, and she has championed landmark legislation in Parliament, played a pivotal role in advocacy and passage of major human rights legislation in the Republic of Ghana. And these include the Domestic Violence Act and supporting the Human Trafficking Act. She also notably previously served as the regional coordinator for the Africa Office of the Commonwealth Human Rights Initiative. A warm welcome to you, Honorable. We also take this moment to invite Dr. Joy Pumapi. Dr. Joy Pumapi is the Executive Secretary of the African Leaders Malaria Alliance. A warm welcome to Dr. Joy. Warm welcome. And Madam Joy, Dr. Joy, is a leader whose decades of service have been dedicated to advancing public health in Africa and enhancing global health security. Her work spans key health priorities that include malaria, neglected tropical diseases, reproductive, maternal, child, and adolescent health, nutrition, pandemic preparedness, and intersections of gender, climate change with health that aim to transform Africa's healthcare landscape by improving accessibility, equity, and response to emerging health threats. Thank you very much, Dr. Joy, for joining us. We really appreciate your time, given your busy schedule. And I think her work was very well noted by His Excellency, Dr. Jakaya Kikwete. I also take the opportunity to invite Dr. Amani Asfor. Dr. Amani is a medical doctor, president of the African Business Council, chair of the Trade Promotion Committee of COMESA Business Council. She's also the vice president of PAFTRAC, the Pan-African Committee for Trade and Investment. She's an entrepreneur who has contributed immensely to the empowerment of women in business in her career. She's also the president of Egyptian Business Women Association, and she is also the international chair of the Medical Women's International Organization. So a very warm welcome to you, Dr. Amani. We also take the opportunity to welcome Prof. Sarah Anyang Agbo. She's been very vibrant during our opening ceremony. Professor Sarah Anyang Agbo stands at the singular intersection of African continental leadership, a former commissioner, a very central member of the advisory panel at African Renaissance Trust. She's also a distinguished professor, accomplished scholar, who has also published a lot. You know, she's really, a great asset, not only to the continent, but to the Republic of Cameroon, where she serves in the Ministry of Education. A warm welcome to Professor Sarah. So, distinguished panelists, allow us just a few minutes to introduce the health financing dashboard that has been referred to several times, during the opening ceremony. And my role at this moment is to really just say we have had to live through a 25-year-old accountability gap. And the dashboard simply comes in to make that gap visible so that every member state, every indicator, every issue that we converse in different dashboards can really be assessed in real time. In the next few minutes, we will walk through what that looks like. So we have our software engineer in the house, Mr. Kafui, who also happens to come from the Republic of Ghana. So Mr. Kafui, we will welcome you in a few minutes to come and tell us or show us how this instrument works. What is important is that the dashboard opens up three things. First, the Abuja at 15, the Abuja at 25 rather, the 15% issue. And then it opens up the ALM where more money for health, more health for money ratio is very important to assess so that we know what to do next. And third, it also ensures that we are seeing a health outcome scorecard that measures different indicators. You will see a map. You will see your country on this dashboard. You will also have the opportunity to compare how your country is performing among other groups of countries, particularly within your region. And you can also benchmark against other, a fair comparison of where your story is within your regional block, within your income level, your governance rating, and even have the opportunity to cross-compare across regions. We have 27 indicators that cover finances, fiscal space, and how the resources have been utilized. We have health impact, also indicators that are already assessed. And through this, we have also taken time to map the exemplars. And the exemplars are the countries that have been most compliant to the African Leadership Meeting declaration that was held in 2019. So you will see the trend of countries and as it is performing from 2019. We also have deep dives, and this is really where policy meets the citizen. So Mr. Kafui, please take the floor and take us through what the tool provides. And if you're a head of state, if you're a minister, if you're a parliamentarian or a civil society leader, we expect that you will find a place where you can share the map, assess issues that are being, that are important for the performance of health financing in your country, and most importantly, we can have a look at what accountability could be at a continental level. Mr. Kafui, the floor is yours, and we'll move into the panel right after that.
Thank you very much, Caroline. Okay. Your Excellencies, honorable ministers, distinguished guests, ladies and gentlemen, thank you very much for the opportunity to demo this to you. Okay, so over the past few months, we've been working on a health financing insights, a dashboard to basically tell the African story with respect to health. With respect to health, I mean how African countries are solving their health issues, basically. And so in order to build this tool, we're considering 27 indicators in total, as Madam Caroline just mentioned, right? And so I just want to run everyone through what it looks like. So there should be a QR code around for you guys to scan so you can have a look at what the application looks like. Okay, so we have the home page. The home page basically summarizes everything you can do with this dashboard, right? And so right after the home page, we are going into the map view. With the map view, we can take a look at the African map. And then from this map, we can see sort of a map that is interactive. And so we can click any country and then have an overview of some indicators and how, and the numbers and how they are being, the stories we are trying to tell with respect to all these indicators. Aside, clicking to check the country profiles, we have an indicator layer basically summarizing all the 27 indicators into 4 groups, as Caroline just mentioned. And so by checking each indicator, we are trying to see an overview of how the African countries are performing. Okay, but now we can compare, on the next page, we can compare African countries with respect to all these indicators I've been talking about. So we can look at Algeria, we can look at our country Ghana, we can look at Nigeria. Let's take Egypt, and so on, right? And so looking at these indicators, we have our 4 categories of indicators, which are finances. We are basically looking at how much money is coming into the African countries. The general fiscal space, we are basically talking about the room the government has to act. And the third one is finance utilization. We are trying to see how the money is being used, or how much $1 can buy, right? And then health impact. We are trying to also see with health impact how the governments are making progress with respect to their policies and how it affects the citizens. Okay, so for instance, let's go to the finance utilization ones. We can see a very beautiful graph that's comparing all these 4 countries. The more countries we add, the more it's populated, right? And so you can check a bar graph, a line chart, to see how the countries performed over time, and the radar. You can also download, and there's also a radar map. You can also download the data for your reports and such, right? So this is for the comparison metrics. Another section is the benchmarking. Now, it's not fair to compare countries with stronger democracies to countries with weaker democracies, or basically countries with different stories to tell, because they are countries with different stories to tell, basically. Okay, so for instance, if we pick a country like my motherland, which is Ghana, Ghana belongs to the, Ghana is in Western Africa, so we can compare Ghana to its Western African peers, okay, and how Ghana is performing and such and such. So we can go down, on the left side, we can see how Ghana, we can see some indicators that we want to, look at and test. So, give me a second, okay. Okay, so we can select our finance utilization indicators by just clicking the finance utilization, or we can just be clicking each indicator one by one, and then we can see the stories. Give me a second. Okay, we can see the stories Ghana has to tell with regards to its indicators, and so we can see that within West Africa, Ghana is second, performing, and so on and so forth. We can see we are somewhere in the middle here. And so we can tell stories to see how, Ghana is comparing in relation to its peers. Now we can also see within Ghana's income group, we can also compare by Ghana's income group. And so looking at our income group, we are performing, quite down there and so on. Where we look at, other indicators like the Mo Ibrahim Index for Governance, we can see how Ghana is performing among our peers, right? So this is also good for the analytics you want to do. And then we have the country profiles, which basically drills down to the indicators just to see exactly how the country is performing with relation to all its indicators. So we have Angola doing all that. And now we have our exemplars. With the exemplars, we are trying to examine the policies by the governments of the countries and to see how the success stories from these exemplars, so that other countries can learn from them. So I'm sorry I'm using Ghana too much because I'm Ghanaian and it's the context I can understand. So as our deputy minister was just talking about how NHIS had some gaps and they had to introduce Mahama Care and all that. A point I'm trying to make is that other countries can learn from this. Journalists the media, can learn from this and to, recommend this to policymakers within their country and such. Then we go into the deep dives. With the deep dives, we are trying to see how the policies by the government is affecting the citizenry, how it's changing the lives of the people within the country. And so there are so many stories here from countries all over the continent. So we can look at, a closer look at how Egypt is transitioning to universal health insurance, and it's a whole case study here. And the document is downloadable for review and such. And so that's basically the summary of our health financing dashboard. We did some analysis and we realized that we could tell over 150,000 stories just by considering these 27 indicators across the 55 countries we are tracking. So basically, that's it with regards to the health financing insights. And yeah, that's all.
Thank you very much. Thank you very much, Mr. Kafui, for taking us through a few minutes of the experience. We have the rest of the year to consult with the stakeholders, with the ministers, with the different layers at the African Union and across the continent on the usability and build capacity on how the 150,000 stories can be generated to advance accountability for health financing in Africa. So I think that was just a small snippet. Please use the QR codes that are with you so that you can start experiencing this system. We'll also be presenting it to the finance minister's STC later this week so that we can broaden the experience and strengthen how accountability will move on. So thank you so much, panelists, for your patience towards that end. I think we have our mics, our roving mics already here, and we'll go straight into conversation with the panelists. I'll probably sit, I don't want to stand from here so we can have a better conversation. So allow me to just move over and we can talk. Panelists, am I audible? Sound, are we audible? It's okay? Thank you, is this better? All right, thank you very much. So our first respondent for this evening will be Honorable Nana Oyebampoe. So straight to you, Honorable Nana. I think Accra Reset has really made the headlines from the last General Assembly in New York of 2025 that was held last year. We've also seen a really great drumming up of support for this advanced campaign that the head of state is leading. So, Honorable Nana, what does the discipline of delivery look like when we talk about Accra Reset?
Yeah, thank you very much for this. But before I answer your question, I'll place it in context and say that for us in Africa, our health story has never lacked ideas or partners. So we have our Alma Ata Declaration of 1978, which gave us primary health care as a pathway to health. We had our Abuja Declaration, which set our 15% target for domestic health financing. We had Global Fund, we had Gavi, that has carried billions into treatment and prevention. We saw what Dr. Peter Pio did to UNAIDS, building the architecture, and also the political will of former President Obasanjo of Nigeria and what he did with the Global Fund. And it's very interesting how this has dived into Accra Reset. And you talk about delivery, the discipline of delivery. And for me, it is the distance between the commitment on paper and the service a citizen, an African citizen, receives. And the discipline of delivery starts with structure. And President John Dramani Mahama defined this in his recent high-level panel in Dakar, where he said, and I quote, "A mother may never read your report, but she'll feel the impact, or she'll suffer from the absence of a new framework." So under the Accra Reset, we have emphasized and stressed on political leadership, because it is all about political leadership. That is where the cake is divided, the injera is split up. So we've placed a presidential council made up of former presidents and existing presidents at the very apex of the architecture of the Accra Reset. We have former heads of state and present heads of state being personally committed to the Accra Reset agenda. Then we also have the high-level panel and a secretariat. Like I said, it's all about structure. And what we're looking at is community, country, regional, and a global framework. So we actually have a three-line stream where resetting the global health architecture is one of our three streams. We do not reject international cooperation. What we are seeking to do is to reset international cooperation and build it on domestic resource mobilization. So looking at the duplicity and closing up overlapping institutions, and also creating relationships that focus on equity and not relationships that focus on dependency. And this is precisely what the Africa Agenda for 2063 looks at, and also the Sustainable Development Goals. So we're looking at health financing that focuses on one national plan. I think this has been part of the global health architecture. And it anchors both on domestic financing and external resources instead of silos of a dozen parallel donor plans, pooling the Ministry of Health and the Ministry of Finance from all different directions. So we're looking at governance, synthesized governance, innovation, regional specialization, and a regulatory convergence, so that we have one full regional market. Thank you.
Excellent, excellent. Thank you. A warm applause to Honorable Nana. And I think as we are on just that thought, you know, there's all the governance that is required to make a difference. And there's excellent lessons that we have learned from Alma and from, the state of how malaria accountability and advancement for action has been managed through the interventions at Alma. Dr. Joy Pumapi, kindly share with us how these political leaders that we are now mobilizing can actually be pushed forward to act on the decisions, on the policies that have been established, and how you have managed to really inspire political decision makers to change and to support, malaria initiatives. And these are things that we can learn and cross-lend to the Accra reset that is building momentum. Thank you.
Thank you very much, and thank you for this opportunity. When we developed an accountability mechanism for the African Leaders Malaria Alliance, we focused mainly on our target audience. So the first and the most important target audience, of course, and users of the mechanism would be the heads of state and government. So we had to look at actions that they themselves can take as heads of state and government to reform policy, to reform the regulatory environment, and like you are saying this evening, to allocate more resources to the health sector. So we looked primarily at what actions they could take. One of the policy indicators, for example, that we looked at was, first of all, whether, looking at malaria specifically, whether malaria is in the National Development Plan, elimination, and whether it is in the health sector plan, and what the target is. Is it aligned with the, first of all, with the MDGs, and then subsequently with the SDG target? Is there alignment? And then what about the regulatory environment? Does it support this? Are you imposing tariffs on medical commodities that would therefore make the procurement and service delivery more expensive for the Ministry of Health? Another policy issue that has come more recently is whether other sectors are actually supporting the Ministry of Health. We are looking now at climate change. We know that with the investments that we are making in environment, which provides ideal breeding sites for mosquitoes, are you actually having a regulatory environment that makes it necessary for the Ministry of Environment to be engaged in vector control? Zambia recently introduced regulation under its mining sector for the mining sector to make sure that any holes that they dig in the mining process are filled immediately, because these pools of water, whether they are from the mining sector, the construction industry, are ideal breeding sites for mosquitoes. So the regulatory environment is extremely important. And then when we looked at the budget allocation, we started by, of course, just looking at pure budget allocation, but we also now look at what about taxes, sin taxes. And we also developed what we are referring to as end malaria councils and funds, where the private sector sits together with the Ministry of Health and the other sectors in government that are responsible for health to assume responsibility for this. So one of the things we are looking at is, as a head of state, have you set up an end malaria council and fund? The countries that have already set up these funds have now mobilized $300 million in just a few years, by just bringing the private sector to the table, the private sector also using these scorecards to hold the Ministry of Health accountable and the other partners in the country accountable. So really the key here is making sure that you use indicators which are actionable, that can actually help the head of state, the minister, and the other partners to be held accountable for the results and for the impact and for the investment.
Amazing, amazing. I think that deserves a round of applause because it's a real case experience of how leaders are endeared to do what really needs to be done to make a great difference. So now we have the spirit of mobilizing leaders. We have the tools. What can private sector do to add value to this conversation? Dr. Amani, you have seen private financing, private sector financing, come to the table to complement the domestic public financing and to help close critical gaps in public budgets. Please tell us more about how these partnerships work.
So thank you very much. First, I would like to thank Africa Renaissance for organizing this, and also His Excellency Kikwete's Foundation and all the organizers. Actually, the private sector has a big role to play. And as Africa Business Council, we are established by the heads of state to be the private sector arm of the African Union. And our founding vision is a competitive, borderless, innovative Africa for trade, investment, and industrialization. We have developed 25 clusters under Africa Business Council: trade, investment, energy, infrastructure, mineral, and healthcare. Professor Dabis is the chair of the healthcare. So for us, it's very important to make sure that we map the gaps within the healthcare infrastructure on the continent. So if we're talking about maternal child health, and His Excellency Kikwete have already alluded to that we are losing 70%, we are losing actually more than 70% for the global maternal health, with at least 178,000 maternal deaths. With newborn, actually about 2.7 million under 5 years, which is more than half the global. And if we talk about non-communicable diseases, for instance, we are losing 70% of our cancer patients compared to 24% only in Europe. Again, we are losing 11.5 million premature deaths in Africa, like 1 million per month, because of lack of the radiotherapy, lack of diagnosis. With reference to maternal health, we are actually lacking of operation theater that can be invested in to have cesarean. We are lacking diagnostic that can save a woman from postpartum hemorrhage. We lack maternal health units and ambulance for the newborn. We lack newborn units which can be equipped actually with incubators, with oxygen productivity. So all this is very important. Again, for instance, for non-communicable disease, for cancer, with a mapping exercise that we have done at Africa Business Council, we discovered that according to Atomic Energy Authority, we need 2 machines of radiotherapy per million. So in Africa, we 1.3 billion people. We need at least 450 machines in all Africa. We need 2,400 machines. In Africa, we have 450 only. 120 in Egypt, 200 in North Africa, 60 or 80 in the Southern Africa. All other countries, only 100 machines, and 22 countries with 0. So one person get cancer, he die, unfortunately. No radiotherapy, no radio diagnosis. In some countries, they send them to India. For instance, Zambia, they send $350 million per year to India for patients to die there. In Nigeria, we just came from Nigeria yesterday, $2 billion go out of Nigeria every year, but we are not saving lives. When also cardiac catheters is lacking, so when somebody gets cardiac attack who needs intervention, they don't have cardiac catheter, they die or they permanently disabled. So this is how we have made this mapping exercise thanks to the effort of Professor Dabis under the Africa Healthcare Cluster. And we have not only NATO, but we are talking. We have developed a mega project on the continent called Ultra Health Africa Healthcare Project to establish 1,000 radio diagnosis, 200 radiotherapy, laboratory. This is a in 37 countries of the continent. This project is for 5 to 10 years with almost $4 billion. This will come from private sector. Actually, we had 2 days ago in Abuja, because we have inaugurated there the Abuja City Walk, to establish a center there, a medical health facility, and with the investment from all over the private sector on the continent, but also from outside the continent, but it needs to have bankable projects. We already did the feasibility study, and for us it's very important when we get the private sector to invest, we need the government to give, I call them the 3 Ds. The first D actually is to see how to make dialogue with the private sector, with the Ministers of Health, with the Ministers of Finance, Ministers of Trade and Industry, to structure this dialogue. The second actually D is about demand to be predicted by the government. If I am an investor and coming to invest in Africa, I need really to see what is the predicted demand from the government. I cannot invest a long-term investment for 10 to 15 years and then I find that the government coming to not procuring from a local African private sector. They go and import the same products. So we need to see how we have a real procurement, and one of the actually things that we have lobbied for, it was adopted by Ministers of Finance and Planning, is to have at least 40% of all government procurement goes to African private sector, including SMEs, women and youth. We have to empower our African private sector. We cannot just talk and stand still and don't empower our private sector. The third D is de-risking. If I am coming to invest on the continent, I need really de-risking. Again, it is very important to see that at Africa Business Council, we have what we call the triad of empowerment, the 3 pillars: private sector strengthening, including SMEs, women and youth, and private sector and professional healthcare strengthening. The second pillar is policy advocacy. We advocate with the government to give an enabling environment for tax incentives. Again, we have recommended to establish the healthcare facility and the healthcare technology, because we need to have our own technology. As a third pillar is about productivity increasing. We need to increase our productivity to see how the private sector actually can invest and make sure that we prioritize our own African private sector. I see you are driving this. So for us as private sector, we are ready to support, we are ready to interfere. We have projects on the ground, but we need the governments to see how they empower its own private sector. Thank you very much.
So much. Thank you so much, Dr. Amani. A warm clap to Dr. Amani. Dialogue, demand, and de-risking. Thank you very much. We pay attention to this as we seek the partnerships to be strengthened. Professor Sarah, our excellent moderator for the day, former AU Commissioner, very core member of the African Renaissance Advisory Panel. Professor, tell us, what priorities should AU leadership take on as we tackle this issue of domestic financing, ensuring that there is accountability, advancing strategic innovations to save our moms and babies? What should the AU take on as we are at the extraordinary summit, just about to begin? Over to you, Prof.
Thank you. Thank you very much. And I believe that this question has been responded to by all the speakers who spoke in the opening session, and of course with all of us seated here. The operationalization of the African Medicines Agency is a historic opportunity for Africa to transform how we develop, regulate, produce, and access medicines, vaccines, diagnosis, and health technologies. It speaks directly to the vision of Agenda 2063, the Africa we want, particularly the aspiration of a prosperous Africa based on inclusive growth, sustainable development, and a healthy population with a high quality of life. and that is Aspiration 1 of the African Union Agenda 2063. For too long, we have heard this story. Africa has depended heavily on external sources for essential medicines, vaccines, and health technologies. And the COVID-19 pandemic reminded us that health security is inseparable from Africa's sovereignty and development. We cannot achieve Agenda 2063 if our people cannot access life-saving innovations when they need them most. Therefore, the first priority must be to make AMA a fully functional and effective continental regulatory institution. What does this require? The first is that we need regulatory harmonization. This is very important because Africa has many regulatory authorities, and this does not give us like somebody said here, one of the speakers said, we work in silos. We are not supposed to work in silos. We are supposed to work together. When we say Mbutu, I am because you are, that collective responsibility is one aspect that we must be able to work together, where we learn best practices from one another. Like for the example that Ghana gave us, when the Honorable Professor Dr. Grace Anyesu Donkwa, you see, I know your name now, I can speak offhand, when she spoke. So harmonizing regulations, regulatory authorities is very important for us. The second point is that we need to have joint scientific reviews and shared expertise. When we speak about science, technology, and innovation, like she rightly said, we have so many. We don't lack strategies. What we lack is implementation. What we lack is walking the talk. What we lack is moving our research from the shelves to the industry, and from the industry to the people. That is why our universities must have technology transfer offices. There is just no way we can talk about Africa without working together. We need to work together. The university must work with the government to the industries, and then the industries to the people. So we need joint scientific reviews and shared expertise. Instead of 55 member states reviewing the same products separately, we should build a system where African scientists and regulators work together, share evidence, and make decisions based on the highest scientific standards. The third is to reduce duplication and unnecessary delays. When we talk about fragmented regulatory environment, that increases cost and delays access. So a stronger continental regulatory system will encourage innovation, improve affordability, and create a more attractive environment for pharmaceutical and biotechnology investment. And then we link regulation with local manufacturing and innovation. African solutions for African solutions. And African solutions to African challenges. Now, for AMA to succeed, member states must demonstrate political commitment. Through what? Ratification. I was listening today when we were in the holding room, and I learned that even the Abuja declaration, up to this moment, only few countries have ratified. So what are we doing? When we say Africa must arise, we must arise from all these things that we do that stifle development. And if leadership, we must own our leadership. Leadership must be responsible. Because when the political will has a vision of change, has a vision of sustainability, then the political will speak to the needs of the people. So the ultimate measure of success is not the establishment of an institution itself, but whether a mother can access safe medicines, whether a child can receive vaccines, and whether communities can benefit from innovations when they need them. This is one of the emphases I learned today in our technical meeting with His Excellency, Dr. Jakaya, Kikwete. So that is the Africa we want under Agenda 2063. What is that Africa? The Africa that is healthy, the Africa that is self-reliant, innovative, and able to provide solutions for its own people. And this is where the African health financing becomes very important.
Thank you. Thank you very much. There we have it, a very excellent panel that has moved swiftly. I think we've really run out of time, but I encourage that the conversation continues. For those who are watching online, we were live streaming this session. Please continue the conversation and let's keep at it. And I think in summary, one is that, you know, when a leader in Africa is emerging to really reconcile and lead the political movement towards resetting our continent, let us join in that, let us support the architecture, let us own the pathway that will move us from equity, or rather from dependency to equity, forgive me. And then we also need tools. Our leaders need tools. They cannot take decisions that we desire without guidance, without the actions that they can take, without aligning them to, you know, specific issues, be they disease-based or whether it's non-communicable diseases. Let us work together to provide the scorecard, the tools, the reference, the insights that can guide them to decision-making. When we look at the private sector, of course, we have said this already. Thank you very much, Private Sector President for Africa. Let us dialogue, let us really create demand that can enable that conversation take place, and let's make sure that we are de-risking even across political regimes, even when there has been change. And thank you so much, Prof. Sarah, for reminding us that we must own our policies, we need to own our specialized agencies, we need to also finance them, so that the fuel that is required to realize the change or bridge the gap between policy and implementation can become a reality. I thank you so much, great panelists. A warm applause, and that brings us to the end of this session. Thank you. Yes, I think there's a photo. Maybe we could just stand or down. Okay, all right, yeah, of course. Thank you. Thank you so much, ladies, for receiving the memo. I think I missed it. Yeah. Thank you very much for the patience and for, you know, stretching through 3 good hours. Thank you, Excellency. So we thank our dear Excellencies who have honored this meeting. I think some of them are leaving for state duty. Thank you, Honorable Minister. Thank you very much, Professor. Thank you, Honorable Nana. We really appreciate you. And we humbly request that you pass by the holding room. Okay, if possible. All right, a very good evening. You're all invited to refreshments and continued networking for those who have the opportunity to stay. We'll continue making the conversation, and we apologize that we couldn't take input from the floor. But a very good evening to you all. Bye.
You've been kept down for much too long. Stand up, please, and say I am free. Don't forget you are welcome home, welcome home. Come with me on this happy trip back to the promised land.
Excel, PowerPoint, the usual.
Right. Welcome to Peterson Analysis. Full deck client ready by Friday. Michael, what's your approach to client analysis?
I start with data, build a model, cross-reference.
How long does that take?
3 days or so.
Jesus said, Jesús dijo, behold, I am coming quickly. He aquí vengo pronto. And my reward is with me. Y mi galardón conmigo.
Do you know the power of understanding where somebody's at? And you put yourself in their shoes and have understanding. It's a powerful thing.
We need to bear fruit because it's the one mission all of heaven is behind. When you start talking to somebody about Jesus, all of heaven smiles on you.
We are called with a heart of passion and a heart of love to speak out because we care about people.
Who are you inviting into this life? The lost, the least, everyone overlooked, everyone who can't earn it in their own strength.
In Matthew chapter 16, Jesus says, I will build my church, and the gates of hell will not prevail. And he gives us the keys to open doors, to reach out to people in need of his love.
Au nom de sentence, Dieu les établit. Dieu devient une personne d'autorité. Pourquoi? Le ciel t'accompagne. Regarde le gouvernement de ce monde. Quand un ministre est nommé, il est accompagné par les motards.
The degree to which God can use you or use me is the degree to which we can be yielded to his leading and to his instruction.
How beautiful upon the mountains. I will see you on the islands. You'll be on the island.
Cheers to our chalice.
such a rush, my baby, slow down, come find your love. I'm hoping you see me, come serve it up. Loving when you stir it up, that body belong on TV. Oh, this feeling I can't hide, you're feeling up my mind, and I I just don't know why. I just don't know why.
Is Dove better than ordinary soap? We are going to prove it. Take a bar of your soap and Dove. Use yours on one side, Dove on the other. The soap wash part feels rough because soap dries your skin. The Dove side is softer, smoother, and more radiant. Why? Dove is different. With 1/4 moisturizing cream, it deeply nourishes for radiant skin all over. Try Dove and feel the difference. You'll never wash with ordinary soap again.
Buy Dove for a chance to win FIFA World Cup 26 tickets and other prizes. Official sponsor of the FIFA World Cup 2026.